This is the news at 10, live from Channels Television. Reporting tonight,
W.H.O.
Hello and welcome, and we do apologize for starting off a bit late. Tonight, good news as Minister of Health declares 4 patients Ebola free, bringing the number of survivors to 5. Federal government suspends the use of the nano-silver drug for Ebola treatment, but says decision is temporary. Nasarawa lawmakers return to Lafia, re-strategize on the impeachment of Governor Tanko Almakura. An unarmed black teenager has been killed by a police officer in Missouri in the United States. On business news, the Central Bank of Nigeria restates its commitment to provide robust financing for the small and medium enterprises.
And on sports news tonight, former champion Rafael Nadal withdraws from the U.S. Open after failing to recover from a wrist injury.
I'm Linda Kibian from Abuja. Low turnout witnessed for collection of permanent voters' card in the Federal Capital Territory, despite INEC's extension of the exercise by 2 days.
A clean bill of health. That's what the health minister has given to 4 more patients earlier diagnosed with the Ebola virus disease. Professor W.H.O said that 4 of them have been managed successfully and have been discharged. Those discharged are 2 male doctors, 1 female nurse, and another patient. All of them are said to have had primary contact with the late Patrick Sawyer. Here in Lagos, the Commissioner for Health, Dr. Jide Idris, while corroborating the Health Minister's story, also said that a lot more is being done to support the 3 patients still receiving treatment at the infectious disease hospital.
You treat a patient based on the presentation. If the person presents with diarrhea, vomiting, you have to replace fluids and electrolytes. If the patient presents with pain and that kind, you have to give pain. If the patient is infected, based on what they say, you give antibiotics. It depends on the presentation of each patient. But I know they have enough drugs, enough medicines to take care of all those things. If they require intensive care, that is part of it again, part of the equipment that have been brought in, they will be provided. Now that we have more medical personnel to handle these people, we still need more. We have more now, so a lot of them now are being given more and more proactive care. As of now, we have 8 doctors who have gone through the training, and it's rigorous training because nobody is allowed to enter there if they go through that training. Anybody there has to go through that training. The training is how to use on the PPE, how to remove it. The essence of the training is that you must understand the protocol within that facility so that you yourself will be safe. The person taking care of the person has to be safe first, because that is where the major problem is. If the man training them is not sure of your safety, he will never allow you to go inside there.
In the meantime, the United States of America has promised to collaborate with Nigeria in containing the spread of the deadly Ebola virus in the country. The U.S. ambassador to Nigeria, Mr. James Entwistle, told journalists in Abuja after a meeting with Nigeria's Minister of Health, Professor Onyebunchi, that the U.S. has pledged its total cooperation with the Nigerian government on the issue. Meanwhile, Professor Onyebunchi says the use of the nano-silver drug for Ebola treatment has been temporarily suspended.
I was in the room in Washington when Vice President Biden and President Jonathan talked about the Ebola crisis, talked about our partnership, and pledged total cooperation between your government and my government on this issue. So I just came over to see the minister this morning to talk to him about that. The Emergency Operations Center, I understand, is working well. The isolation ward, I understand, is working well. So this is an example where we just have to, as part of the broad partnership between our 2 countries, we have to just keep collaborating and cooperating and working hard. That's what I came over to talk to the minister about.
We took delivery of these drugs from the Nigerian scientists
on that Thursday, much later in the day, in Lagos, and handed it over to the incident management team in Lagos, and then started waiting for the consideration of the National Health Research Ethics Committee. They issued a preliminary no, that was on Friday, and in issuing a preliminary no, I said the reason was that they still needed more information, which we asked the scientists to provide them. And then on Saturday, early by 5 a.m., they told me, well, that it didn't pass the standards in our National Health Research Ethics Code. So I then didn't approve. So no patient has received it. But the bottom line is that we're not using it since it did not pass through the National Health Research Ethics Committee.
Now, the entire clergy and congregation of the Anglican Diocese of Niger are protesting the demolition of St. Ebenezer's Anglican Church. That's in Nkwele, Ezunaka in Oi, local government area of Anambra State, by unknown persons on Tuesday, August the 13th. The building, which was still under construction but at roofing level, has been reduced to rubble. Accusing fingers are being pointed at the President General of the community, Chief Chris Elumeno. The Anambra State Governor, Willie Obiano, visited the site and has condemned the act.
Parishioners of St. Ebenezer's Anglican Church, Nkwele Ezunaka, in Oyi local government area of Anambra State, woke up to this ugly reality that their church building, which had gulped about 13 million naira in construction, had been completely demolished by unknown persons.
They came by 1 o'clock and pulled down a huge church, as you can see. Who on this area is living with a good heart can put down a church? A church is a place where the public worships. And the 2,000 members of the church are displaced now. Children, widows, orphans, who brought their money together and built this church. They have been displaced, now no place of worship.
The President General of Nkwele Ezunaka, who is being accused of being the masterminder, denied being involved in the demolition as he was in Abuja attending the national conference as a delegate, but he did not hide his feelings.
Based on the activities of the Anglican Church there, I said I was banning them from worshiping in the school. They are tenants to the school. I did not miss words about it. When they wanted to build the church, they came to my house. They led a delegation to my house that they want to put a church building where they worship. I said, no, you can't do it. It's a public school and it's owned by government. I will not allow you to do that unless the government authorizes you to do that. That was what I told them, and they left. So this madness and this craze about building a school, that place has to stop. The document with which the community gave us the land is with us here. We've shown this to the government of Anambra State through our Bishop, Reverend Owen Wekoro, and he has it all. And we have everything that has been drawn, including the survey plan of this place. Okay? And when the government was handing over school to the mission, because the school and the church runs in common, when the government was handed over back to schools, to churches, this is among the few that the government of P2B handed over to us.
The state governor, Willie Obiano, has condemned the incident and announced an investigative committee will be set up.
In 2 weeks' time, this committee I've just set up to investigate the challenges we have here will send us a report. Whatever is destroyed there, at the appropriate time, government will do appropriate reparations.
While there may be assurances from the government of making necessary investigation, the church, however, wants the government to follow up on the issue and bring the culprits to book.
In part 2, after the break, INEC Chairman Atahiru Jega asks party leaders to train their agents on good conduct during elections. That's in a moment. You join us again.